According to the United Nations, about 736 women across the world have been subject to physical or sexual intimate partner violence, non-partner sexual violence, or both, at least once in their lives. Women in South Africa also experience these types of crime. Those in the front line of healthcare service have taken a stance by marching and raising awareness of the scourge. Furthermore, they also want to use the principle of Ubuntu in the treatment of victims and survivors of gender-based violence when they reach the clinics and hospitals.
We are still struggling as a country with issues of gender-based violence. We then formed a team that collaborated with Mafikeng Hospital, because one of the things or the main objectives is to bring Butubaruna in our communities, in our hospitals, and also intrapersonally, so that people must learn about Ubuntu again.
Some are advocating for focus groups to talk about these issues affecting women.
I think we should have forums where we talk as women. We must have dialogues where we share our experiences, where we share our problems. Because after sharing the problems, we find that those who were in a focus group said, hey, I feel like I was in a therapy. I feel I was in a therapy. I feel better. Because I thought I was the only one who was going through this a painful situation. And only to find that I'm not the only one.
Others say women are still left to fend for themselves when it comes to taking care of their families.
We have mostly observed that the males are not involved. So it's basically the role of the mother who is still carrying the baby at that moment. Although there are some fathers who accompany the mothers to the facilities, which is showing some sense of support. But I think we are still lacking with them, and also we need to accommodate their presence and acknowledge that they are there.
There is also a call for the return of Ubuntu in communities.
So if we were to use these principles of Ubuntu, which is equality, then we would mitigate such compassion. You wouldn't treat somebody that you care about in a violent manner.
Ubuntu can be used to cap down gender-based violence in a way that if I can value the next person, I can be able to protect the next person in all aspects.
The program envisages helping people in rural and underdeveloped communities, especially survivors of GBV, to get their dignified health care. Jabu wa Africa, SABC News, Mahigeng.